Thailand has made tremendous progress towards malaria elimination since 2013. As of 2019, 35 of 77 provinces are malaria-free. However, the country is still faced with challenges. Vivax malaria is one of them. It is harder to cure than other forms of malaria. It lies dormant in a person's liver, can relapse causing a new bout of malaria, leading to renewed risk of transmission. This underlines the need for additional reliable, well-tolerated, and effective radical cure for P-Vivax, which will involve 4 steps. 1. A malaria diagnostic test. 2. A diagnostic test to determine glucose 6-phosphate dehydrogenase or G6PD enzyme activity. 3. A drug to kill parasites in the blood. 4. Another drug to kill dormant parasites in the liver. As the current treatment is a 14-day regime with Prequalification, follow-up by health workers and patient adherence is a challenge. A new single-dose treatment, Tafenoquine, is available to supplement current treatment. Thailand is leading efforts to bring about universal access to a Vivax radical cure across the region. It is the first country in Asia to approve and register Tafenoquine as a single-dose radical cure for Vivax malaria in December 2019. Deployment of a Vivax radical cure, whether Prequalification or Tafenoquine, requires screening of patients for G6PD deficiency. The diagnostic test that quantitatively measures G6PD enzymatic activity has also been registered in Thailand. Through the Indo-Pacific Regulatory Strengthening Program, the Australian Therapeutic Goods Administration worked jointly with the Thai Food and Drug Administration to support the review process of this new drug. The collaboration between the Thai FDA and the Division of Vector-Borne Diseases to introduce Tafenoquine is an example of how disease programs and regulatory authorities can work together. However, registration of the drug doesn't imply the immediate rollout of the treatment regime. The introduction of new tools needs to suit the context within which they will be used. Thus, feasibility studies will be conducted to determine which radical cure regimens can be safely offered at different levels within the health system. Tafenoquine, along with quantitative G6PD testing, will be piloted in the Yala province of southern Thailand. With the feasibility studies underway, Thailand is also rolling out G6PD testing with the current treatment. Healthcare workers will be trained on how to safely administer the cure after testing for G6PD. Administering Tafenoquine requires the monitoring and reporting of adverse drug reactions, particularly in relation to hemolysis. A strong pharmacovigilance plan is being rolled out. Other radical cure options are also being explored, such as using Prequalification for 14 days along with quantitative G6PD testing, or using higher dosage of Prequalification for 7 days. Depending on the results from these feasibility studies and other evidence on the use of current or new tools, the national treatment guidelines for malaria may be revised. Tafenoquine as a radical cure for Vivax malaria is being used as a case study for the new harmonized World Health Organization Prequalification and Policy Recommendation Process. As the region awaits World Health Organization's recommendation, countries can plan for its introduction by preparing their health systems. Each country will need to choose the radical cure strategy and tools that work best for their context to achieve the goal of malaria elimination by 2030.